You were diagnosed, what was it, 5 years ago with incurable blood cancer. What was the first thing that went through your mind when you were given that diagnosis as a doctor yourself, a plastic surgeon, but as someone who has helped patients and now you found yourself in the seat of a patient with an incurable cancer?
Well, you really can't describe what it's like when you're told that you have cancer. We can all kind of go through a scenario in our head and we think we can handle it. But I think the biggest thing is we all know we're going to die, but when it's right in front of you, you really do an evaluation of your spirituality, your friendships, your marriage, everything. So it was a shock. I must say, I think I told you before, I had a very prosperous plastic surgery, med spa, anti-aging center. And I did a lot of the things that I would tell my patients to do. And I thought I was extremely healthy. So when I came down with this diagnosis, it was definitely a huge shock.
Now, what did you do then after the shock? Were you originally on path to go with a conventional treatment plan?
Well, my story actually started about 2 months before I was diagnosed. My wife and I were on a 2-week Viking cruise, and I've read well over 300 books on health and nutrition in my career. And anytime I'm on a vacation, the first thing I do is I look for a health and nutrition book. So we're on this 2-week cruise. I go into Kindle. There's a book called How Not to Die by Michael Greger. I don't know if you've ever read it. I would recommend your audience to read it. It's an incredible book that really totally changed my life. If you get the hardback, it's about 2 inches thick, and 1 inch of it are scientific references. I never counted how many scientific references, but there have to be, over 3,000 scientific references in there. And as I was reading the book, the science was just showing over and over again that cultures and research cohorts that ate more plant-based had much lower incidence of cancer, cardiovascular disease, diabetes, dementia, really all-cause mortality. So on this cruise, I decided I was going to eat whole food, plant-based. I told my wife, she thought I was out of my mind because, we had all this meat and eggs and dairy and everything on this cruise. But I'm one of these people, when I decide to do something, I just do it. So before I got diagnosed, I had already been eating whole food, plant-based. And that's really one of the reasons why when I got diagnosed, the type that I have is called an IgA myeloma, which is the most aggressive of the three. For your audience, myeloma is a cancer of the plasma cells. They're the cells that make your antibodies. And there's IgG, IgA, IgM. IgG is kind of in the middle. IgM is the least aggressive. IgA is the most aggressive, which is the type that I have. And my oncologist wanted me to do this triple regimen, 2 oral medications, and then a shot that I would have to get into my abdomen every week called Velcade. And when I started reading about Velcade, almost everybody that gets it gets a pretty bad peripheral neuropathy. And being a surgeon, that concerned me. I don't want my fingers to be, jeopardized. So my oncologist pulled me into a side room and tried to get this other patient who had gone through Velcade to talk me into it. In fact, that guy's a good friend of mine. We always go out to lunch. Ever since then, we kind of befriended each other. But I went back to my oncologist into the other room and I told him, listen, I'm not doing the Velcade. And I said it for a couple of reasons. First off, I didn't want the peripheral neuropathy. But secondly, I had already been eating a whole food, plant-based diet, and I was confident that that was really going to help me. So every month on these 2 oral medications, I was just getting better and better. My oncologist never thought I was going to be able to get into a remission without this shot. By 6 months, I was in a complete remission, and I've stayed that way for 5 years now, and with a much lower dose of these 2 oral medications. So I still am on medication. One thing that I do when I counsel, I do a lot of lifestyle cancer coaching for patients. And I do not recommend that they get off of their conventional therapy. I really believe in an integrative approach. You really got to do a little bit of conventional. You have to do natural. You have to do psychological. You really have to approach it holistically. So I really encourage them. In fact, I have a lady right now that I'm coaching. She has ovarian cancer, and she went through all kind of alternative treatments and didn't do the conventional. Now she's got it in her liver and her lungs, and now I'm trying to push her to different types of modalities besides what I do, like hyperthermia treatment and ozone treatment and so forth. But I do still take a small dose of the conventional medication, but I've been able to live extremely healthy life. Like my cardiovascular system's great. My blood pressures are great. But what happened with me when I first got diagnosed, I went into a deep dive into the scientific literature because I wanted to find out everything that I could do naturally to increase my chances of getting into a remission and then staying there.